Guess?
I have literally no idea. Something related to cough. What is something related to cough?
Okay, that is incorrect. Would anybody like to steal for fake points?
Alice is the only other person to buzz in.
You're on the same team, so technically you can't steal, but this isn't for points, so go ahead.
What is malaria?
It is not malaria. Let's go ahead. Okay, do we want to steal again? I mean, it's not a real question.
Anyone have any idea? No. Okay.
All right.
Yeah.
The correct answer is pseudobulbar affect. This is uncontrollable laughing or crying.
Great.
It's a really interesting drug.
Sorry.
No, you're good.
Sorry, it looks like we've got the YouTube stream up now, so we're good to start whenever. Does anyone have any questions before we get started? I also want to mention that we also have Jolie here. She is a Campbell student who is going to help make sure that we are scoring things correctly. So it's not just me and Shane scoring. We have someone else to hear back up also. So yeah, any questions? If not, we'll hand it back to Shane and we'll get things rolling.
All right, we feel good about buzzing. Does anybody have any questions before we start? Not seeing any hands raised, no questions. Okay, then I guess we can proceed. So give me just a moment. So Kevin, how would we like to determine who actually goes first? I didn't consider that.
That's a great point. Whoever buzzes in first gets to pick the first category. Matt. There we go.
Okay, let me.
UNC will pick first and Matt will pick the first category.
Perfect. So awesome. So let's go ahead and share the screen now. All right, can everybody see the screen?
We can, yeah.
All right, I will read you the categories and tell you a little bit about them. First up, we've got brand generics. This one should be pretty straightforward and something that we as pharmacy students are all fairly familiar with, and it's going to definitely help us succeed as we go on to wherever job we're going to be working in the future. Next up, ABX, antibiotics and the bugs on which we use them. Third category is anti, are you okay? Last category is Lord of the Rings, and maybe not the rings of power from Middle Earth, but more like chemical rings of that nature. So right. Matt, I believe you're up first.
All right, I'll take brand generic for 3.
Brand generic for 300. Okay. Tiotropium.
Mia was the first one that buzzed in.
What is Spiriva Respimat?
That is correct. So that is 300 points for UNC, taking the lead. All right, so that means that Mia, it is your team's choice for you've got the board.
Let's go with antibiotics for 100.
Antibiotics for 100. All right. This compound is combined with amoxicillin to defeat bacteria who've learned to fight back.
First is Hannah from Campbell.
What is clavulanate?
That is correct. Clavulanic acid or clavulanate. That is a hard word to pronounce, but you got it perfect. So that's for Campbell, right?
Correct.
Awesome. So that's 100 points for Campbell. Moving right along, the board is yours, Campbell University.
We'll take brand generic for 100.
Brand generics for 100. Irbesartan.
First was Duval.
What is Avapro?
That is correct. That is 100 points for High Point University. Now, High Point, the board is yours.
We'll take antibiotics for 200.
Antibiotics for 200. Fluoroquinolones can cause a rupture of this part of the body, named for a hero of the Trojan War.
Duval again.
What is the Achilles tendon?
That is correct. The Achilles heel or the Achilles tendon. So that's High Point University up to 300. The board is still yours.
We'll take antibiotics for 300.
Okie dokie. This class of antibiotics is old, even older than penicillins, and was commonly used in battlefield medicine.
Mia.
What are polymyxins?
That is incorrect. Would anybody like to steal?
Second was Alice.
Or sulfur compounds or sulfur?
That is correct. The answer is sulfa. Yes. Sulfa's been around about 20 years before penicillins came out. All right, the board is yours, Alice.
I'll take antibiotics for 5, please.
Okie dokie. All right, hitting a home run. Let's go. This drug, usually administered by IV, is taken orally to treat C. diff.
Virage.
What is vancomycin?
That is correct. Vancomycin is correct. So that's Virage is UNC. No, I apologize. Wing it. I apologize. Sorry about that. All right.
And then did you give points? There's in the chat for high point stealing the last one.
I did not. I apologize. That was
Thank
for
you.
300, right? Yeah.
Perfect.
All
Wanna
right.
make sure.
Wing it. The board is yours.
We'll take antibiotics for 400.
All right. Let's clear out the category. You might employ ceftazidime or Zosyn if you suspect this bacteria associated with burn wards.
Duvall was first.
What is Pseudomonas?
Pseudomonas or P. aeruginosa. That is correct. Very good. Also known by its sweet smell. Duvall, the board is yours.
We'll take brand generics for 200.
All right, brand generics 200. Namenda.
Callie.
What is memantine?
I will accept that. Memantine, that is correct. Very good. All right, Callie, the board is yours.
I'll do anti. Are you okay for 100?
Okie dokie. If you're having a runny nose or an outbreak of a rash, you might want to take one of these.
Matt.
What is an antihistamine?
That is correct. So that's UNC on the board with 100 points. Matt, the board is yours.
I'll do brand generic for 5.
All right. Loestrin. This is a tough one.
Zoe buzzed in.
What is ethinyl estradiol?
That is incorrect.
Jules from Campbell also rung in after Zoe.
Is it norgestimate and ethinyl estradiol?
That is also incorrect.
What?
I don't know. Mia just buzzed in. I don't know if you can answer again if another student from the same school has already answered.
Technically, no.
Okay. Sorry. Yeah, we should have explained that up front. Once someone from your school answers, it's only allowed for other schools.
Yeah,
to-
that's okay. I did mention that during the PowerPoint, but that's okay.
Anyone else from, I guess, Wing It or High Point want to try?
I think we're past 10 seconds.
Okay.
All right, let's reveal the answer. Ethinyl estradiol norethindrone. So you were very close, very, very close, but not quite close enough. So that was, who had the board last time?
Me.
Okay, you can go ahead and choose another category, dollar value, please.
And finish a category.
Brand generics for 400. Lyrica.
Hannah.
What is pregabalin?
That is correct. Good job, Campbell.
We're back to 0. We're back to
Brings you back to 0. Awesome. So Campbell, the board is yours. We've got 2 categories left. Annie, are you okay? And Lord of the Rings, where are you going to take us?
Can we do anti? Are you okay for 200?
Annie, are you okay for 200? These large Y-shaped proteins combine chemically to intruders in the body.
Mia.
What are antibodies?
That is correct. Very good, Mia. You've got some points for your school. Mia, the board is yours.
Let's go with Annie, are you okay for 300?
All right. Benzodiazepines like Valium and Klonopin fall into this category of drugs.
Duvall? Did you hear me, Duvall?
Um, what are anticonvulsants?
That is correct. Good job, Duvall. 1,300 points, taking the lead. All right, Duvall, the board is yours.
We'll do Annie, are you okay for 400?
All right. Annie, are you okay for 400? Certain drugs like Benadryl or dicyclomine might have this type of side effect, which warrants their appearance on the beers list.
Hannah?
What is anticholinergic?
Excellent. Very good. Something definitely important to know. So that is points for Campbell University. Good job. Back in the positive. Campbell, the board is yours.
We'll take Are you okay for 500?
Clearing out the category. These drugs slow or stop the development of a tumor.
Hannah again.
What are anti-neoplastic?
That's correct. Excellent. So that was Hannah, you said?
Mhm.
Perfect.
Yeah, Campbell.
Campbell University just got themselves 900 points. Awesome. So we got one category left. Nobody's touched this category. Why not? This is a fun one.
We'll do 100 in this category.
100?
Yep.
All right. A benzene ring with a single alcohol group.
Hannah again.
What is phenol?
That is correct. Good job. Up to 1,000 points for Campbell. What have we got next?
We'll do 200.
All right. Early antidepressants and antipsychotics had a three-part structural motif in common, earning them this class name.
Matt.
What are tricyclic antidepressants? Or
Well,
tricyc-
we're looking for tricyclics, but yes, you got it. That is correct. So that is 200 points for UNC, bringing you back to a even balance. Let's go. Next question, Matt, the board is yours.
300.
300. 2 carbons and 1 oxygen compose this unstable ring.
Jules.
What is epoxide?
That is correct. See, this category is not that hard. That is an epoxide. So that was Jules from Campbell. Awesome. All right, $2 values left. What's it going to be?
We'll do Lord of the Rings 400, please.
Right, 400. Caffeine, theophylline, and other purine derivatives have these membered rings.
Mia.
What are 5-membered rings?
That is incorrect.
Sorry. Does anyone else want to buzz in?
How many more seconds we got?
That's about it. Yeah.
We were looking for 6 and 5, so very close with 5. And what school was that?
That was UNC.
That was UNC. Okay, that's what I thought. So that brings you back down to negative 400. There's still a whole nother round after this, so don't fret. And now we've got the last dollar value, 500 points, Lord of the Rings. Ready? 3, 2, 1. Steroids have this ring structure.
All right, that's 10 seconds.
Come on, y'all. 6665. This is basic medicinal chemistry. I think we learned this on the first day of school, P1 year. All right, so that is excellent. So we have just completed the game. We've got Campbell and High Point in the lead with 1,300 points, followed by Wingate with 700. And last but not least is UNC with negative 400. So there's still a lot of room to catch up. The game could go any direction because the double points category in round 2, I think this is going to be some serious drama coming up. It's going to be a lot of fun. So let me stop sharing this. Do we want to take like a 3-minute break, 5-minute break, or do we want to just jump right into the next game? All right, I see some breaks. Yeah, let's get some nodding. I think we can take like a 5-minute break and then come back, Kevin.
Yeah, that's fine. That was a pretty quick first round. Good job, everyone. And then I'm gonna talk to Jolie and make sure we got everything correct for scoring. So we'll get started. Let's say 125.
Perfect.
All right, after conferring with Jolie, it looks like we did miss adding 300 to UNC at one point, so they should have negative 100 instead of negative 400.
Okie dokie. Everything else look good?
I think everything else looks good. Does anyone else have anything that they think we missed?
No, everything else looks good.
Okay,
All right,
thanks,
awesome.
Jolie.
Thanks, Jolie.
Can I ask a question?
Sure.
When we buzz in, does it only take like the first 3 people that buzzes in on the screen?
No, I see everyone that buzzes in. So I see a list of like 12 people.
Okay, because on
Yeah.
my phone it's just showing like 3 names, so I wasn't sure if like my buzzer is not working or if I don't know what's going on.
No, I think it should be. But like I said, I can see everyone that buzzes in. Before we start again on the next round, I can just get everyone to test it one more time to make sure I see everyone's name.
Okay, awesome. Thanks.
Yeah. All right, if everyone wants to start coming back and get our screens back on, we'll get started in about 30 seconds. And in case you did miss it, we did have a score correction. 300 more points were awarded to UNC, so you're at negative 100 instead of negative 400. Thank you again, Jolie, for double checking us. All right, Shane, I think we're about ready.
Perfect. Let me get everything situated on my end. So now we are rolling into double Jeopardy. So we've got double the points, double the stakes.
Real quick, I just want to make sure everyone's buzzer is still working. So if you just want to buzz in. So I've got 9, 10. So Mia, Jules, Hannah, Matt, Zoe, Callie, Sean, Braj, Deval, Maddie, and Alice. Everyone good? Cool. All right, I think we're good, Shane, whenever you're ready.
All right, can everybody see the game screen?
We can. Yep, we're good to go.
Excellent. And so begins round 2, double Jeopardy. Our categories are OTC, otherwise known as over the counter. Next, we've got drug interactions. These are something you're definitely going to need to keep an eye out wherever you're working, whether it's retail or hospital. baker's dozen. All of these answers have 13 letters. And then finally, this category is musician drug mashup, my favorite category. Answers to these questions could be something like Rage Against the Morphine, which is a combination of Rage Against the Machine and morphine, or maybe Beatles, like Butalbital and the Beatles. So it's going to be a mashup of a band name and a drug. So who answered the last question? Who's going to be up first?
I think regular Jeopardy usually starts with the lowest score. So someone from UNC could.
So then UNC.
Whoever wants to pick a category from UNC.
Let's do OTC 200.
Okay.
OTC 200, starting small. Let's see what it is. This amendment to the Federal Food, Drug, and Cosmetic Act defined 2 specific categories for medications, prescription, and over-the-counter.
Maddie.
What is Durham?
I'm
I don't know.
gonna accept that.
Okay.
It's the Durham-Humphrey Amendment. I'm gonna accept that. Who was that again? That was Maddie?
Yes, Wingate.
Wingate, thank you. All right, up next we've got
Duvall
Wingate.
is, 1 second. Duvall is requesting a quick timeout for his earbuds.
Sure.
If that's okay with everyone. So hopefully, Duvall, can you give a thumbs up or something in the chat whenever you're good?
Well, if you can't hear us.
Yeah, that's true. I don't even see him. Oh, there he is. Duvall, can you hear us yet? Duvall, are you good?
Yeah, my audio's back.
Okay, cool. We're good to go.
So Wingate, the board is yours.
Let's keep going with OTC. OTC for
OTC
400.
For 400. All right. For a 20-kilogram child, this would be an appropriate acetaminophen dose for fever.
Viraj,
What is 200 milligrams?
I think we also need a frequency.
Oh, every day? No, wait. Every 12 hours.
You said 200 milligrams every 12 hours. That is incorrect.
All right, Zoe buzzed in afterwards.
What is 300 milligrams every 8 hours?
That is incorrect.
Mia's at the same school as Zoe. Does anyone else want to give it a shot? Give 5 more seconds. All right, that's it.
This is a tricky one. So you were really close. It's 300 milligrams every 4 to 6 hours. Acetaminophen dosing is really important, especially for children.
Mm-hmm.
So I guess it's still Wingate's category.
Okay, let's do drug interactions for 200.
All right, yeah, let's take a look at another category, see what we can find. This supplement must be avoided while on spironolactone therapy.
Hannah.
What is potassium?
Excellent. Potassium or potassium chloride. Potassium, a sparing diuretic. You don't want to take potassium. So that was, and what school was that? I apologize.
Campbell.
Campbell. You're quick to respond when you've gained points, but if you've lost points, you want to keep it a secret. All right, Campbell, category is yours.
Drug interactions for 400.
All right, let's see what we've got next. Effects of Nsaids on beta blockers.
Duvall.
What is increase serum concentration?
That is incorrect.
Anyone else? Give it 5 more seconds. Nope. All right, that's it.
The correct answer would have been decrease the beta blocker's ability to lower blood pressure. So it's not going to affect the concentration. It's going to be kidney function. All right. I believe Wingate, the board is still yours.
I think it was Campbell.
Oh, Campbell. I'm sorry, Campbell.
Yeah, we chose that one.
Yeah,
We'll do Baker's dozen for 200.
Baker's dozen for 200. Okie dokie. This antipyretic drug also has analgesic properties and is abbreviated APAP.
Hannah.
What is acetaminophen?
That is correct. Excellent. Very good. So Hannah is Campbell.
Yes.
Okay. I'm learning. Campbell, the board is yours.
We'll do Baker's dozen for 400.
Baker's dozen for 400. Let's see what we got. This disease is characterized by hallucinations, delusions, and a surplus of dopamine in the brain.
Matt.
What is schizophrenia?
That is correct. Excellent. Almost back to positive. You're at negative 100. We'll get there. UNC, the board is yours.
OTC 6.
OTC for 600. This class of OTC medications for treating heartburn are usually taken in the morning for 14 days.
Raj.
What are PPIs?
Excellent. That is correct. Proton pump inhibitors, otherwise shortened to PPIs. So that is Wingate. I just want to double check. Excellent. 1,100 points, Wingate. The board is yours.
Let's do drug interactions for 600.
Okie dokie. Drug interactions for 600. Effects of combining ACE inhibitors with ARBs. This is a tricky one.
The ball rang in at the last second.
What is hypotension?
That is incorrect. Would anybody else like to steal?
I think that's it on time.
Okay, the answers we're looking for would be renal dysfunction, high risk of vascular events. Also, angioedema is very highly associated with this interaction. So let's proceed with the next question. I believe, who's got the board right now?
I think it was Wingate.
Okay.
Let's do drug interactions for 800.
Drug interactions for 800. The interaction between flagyl, otherwise known as metronidazole, and alcohol.
Hannah.
What is a disulfiram-like reaction?
Excellent. That is correct. Disulfiram-like reaction, which results in excessive vomiting. Studies have shown that this is kind of controversial. They don't think it actually happens as much as people are afraid it does. So let's give those points to Campbell University. That brings you to 2,500. You are taking this game by storm. The board is yours.
Baker's dozen for 600, please.
Baker's dozen for 600. Is everybody afraid of the musician drug mashup category? That's my favorite category. Come on. If your blood sugar rises too high, you're in this state.
Duvall.
What is hyperglycemic?
That is correct. Hyperglycemic or hyperglycemia, same number of letters. So that brings High Point to 900 points. Still in third place, but I think there's still some room to change this game up. High Point, the board is yours.
We'll do OTC for 8.
OTC for 8. Back to the roots. The recommended daily intake of fiber for an adult man. I'm well below this limit every day.
All right, no responses.
Did we get to 10 seconds? Is that it?
Yep, that's it.
All right, we're looking for 35 grams. I can't even visualize 35 grams of fiber. What is that, like 600 apples? I have no idea. All right, who's up next? I think that's High Point's board still yours.
We'll do musician drug mashup for 200.
All right, finally. A popular cough suppressant in this group of better men. Nobody?
All right, that's it.
I'm looking for Tessalon Pearl Jam. Come on, y'all. Y'all don't listen to Pearl Jam? That's okay. I don't listen to Pearl Jam either. So that was nobody. High Point, the board is still yours.
We'll do baker's dozen for 8.
Baker's dozen for 8. All right. You've tested the waters of that category and you want to move back to something more familiar. I understand. 800 points for baker's dozen. This type of surgeon specializes in the mouth and jaws.
Maddie.
What is maxillofacial?
Excellent. That is correct. Maxillofacial. So, Maddie, that is Wingate University. Excellent. You're at 1,900 points, trailing behind Campbell by just a small margin. Let's see what happens over the next couple of questions. The board is yours.
I'm going to go with baker's dozen for 1,000.
Baker's dozen for 1,000. Okay. This type of round bacteria cluster together like grapes.
I'm sorry, that's my fault. My mouse was being weird. But Hannah.
What is staphylococcus?
Staphylococci or staphylococcus. That is correct. Excellent. Campbell University, you're up to 3,500 points, followed by Wingate with 1,900, High Point with 900, and UNC with -100. This still could be anybody's game.
Sure. We'll do OTC 1,000.
All right, OTC 1,000. This form of calcium supplement contains the highest percentage of elemental calcium.
Hannah again.
What is calcium carbonate?
That is correct. Calcium carbonate with 40% elemental calcium. Awesome. 4,500. The board is still yours.
We'll finish out drug interactions for 1,000.
Drug interactions for 1,000. The interaction between Lopid or gemfibrozil and Coumadin, otherwise known as warfarin.
Braj.
What is increased INR?
Excellent. That is correct. Increased INR or increased anticoagulation effect. Definitely something you want to keep an eye on and monitor very closely. So we are going to give those points to Wingate. Excellent. Wingate's up to 2,900 points. Now let's see if we can tackle that musician drug mashup category. Let's go, Wingate.
Let's go for 400.
400. Join the Black Parade with this brand name macrolide for conjunctivitis.
Mia.
My clarithromycin romance? What is my clarithromycin romance?
That's really good. Kevin, I'm leaning towards accepting that.
I don't have the answers in front of me, so I don't
All right.
know what it is.
What we were looking for is my chemical romycin, but my clarithromycin romance is really good too, so we're going to accept that. Thank you, UNC. Good job. You brought yourself back to positive with 300 points. My clarithromycin romance. That's a good one. Thank you. All right, so we've got 600, 800, and 1,000 left. We've got 3 categories. UNC, the board is yours.
Let's do 600.
600. All right. Axl Rose starts a band with this potent HMG-CoA reductase inhibitor.
Mia.
What is guns and rosuvastatin?
Yeah, you're getting the hang of this. Guns and rosuvastatin. Awesome. Brings you up to 900 points. You're now tied with High Point for last place. You brought yourself back up from negative. Let's see where you can take us now. Let's go, Mia. What's next?
Let's go with 800.
800. Do you remember this groovy band from the 70s and this 3-in-1 headache drug?
Matt.
What is Earth, Wind, and Fiorset?
You got it. Earth, Wind, and Fiorset or Furanol. We would have accepted that too. You got it. So you're up to 1,700 points. You're really taking this category seriously, and I respect that. So last up, we got musician drug mashup for 1,000. 3, 2, 1. Instead of his curly-haired friend Art, Paul starts a band with the HPV vaccine.
Matt again.
What is Simon and Gardasil?
You got it. Simon and Gardasil We got some Simon and Garfunkel fans in this game. Awesome. So that brings you up to 2,700 points. And that, ladies and gentlemen, is the last question of the game. So that completes the game. UNC, that was a really valiant effort at the end there. Unfortunately, it does not bring you to victory. It does bring you out of negative and into third place, which is excellent. High Point trailing behind a little bit with 900 points. We've got Wingate in second place with 2,900 points. And in first place, we have Campbell University with 4,500 points. You are our champions. You are our winners. I am really excited that we had this opportunity to play this game. You guys all played really, really well. You guys did really great. I'm really impressed with everybody. Campbell University, you are our champions. So Morgan, Hannah, and Jules, you guys did a great job. I'm really glad that you guys pulled this off. You guys did really, really excellent.
Thank you so much.
Thank you.
Thank you. And thank you to everybody who played.
Congrats.
Sounds good. All right, Shane, if you want to stop sharing your screen, just give some quick closing remarks. I just want to thank everyone for coming to our student conference this year. Whether you participated in the residency showcase or our other programming, we really appreciate your attendance and being here. Like I said at the beginning, my name is Kevin Rash. I'm a fourth-year pharmacy student and serving as the Student Pharmacist Forum Chair this year. We do have a lot of great events coming up in the next year or so for this academic year, and we would love to have your support and see you all there. We've really focused on advocacy and legislation the past year, and we hope to continue that in the future. We are here to represent students, technicians, and pharmacists, so we would love your support. We have a great leadership team, so if you ever have any questions about NCAP SPF, I would urge you to reach out to your local leaders, or if you want to reach out to Shane or myself, we'd be happy to talk to you about it. But we're happy that you all joined us. Congratulations again to everyone that competed, and congratulations to Campbell. We hope to see you at our future events, and thank you once again. Bye, everyone. And thank you, everyone, for watching on YouTube. We hope you enjoyed this as well. And thank you for cheering on your local teams.
Are we still
Thanks, Shane.
streaming?
Yeah, I think we're still on YouTube.
It's still listed as live, so yes.
Yeah.
Right, well, thanks, guys. I thought it was a wonderful. I'm going to take off here, and then I'll probably send out a message just to follow up afterwards, but let me know if you need anything. Thanks for all your hard work.
Perfect. Thanks for your
Dr.
work
Neely.
also, and coordinating all our meetings and setting everything up. It was great working with you.
Absolutely, you too.
Yep. All right, Shane, I think I'll log off also, just so we're not talking on YouTube.
Yeah, that's fine.
But I thought it went well also. If you
Yeah.
have any follow-up or anything, feel free to text me.
Sounds good. Will do. I'll see you in the chat.
All right, see ya.
Thanks.